Hello, everyone. This is Drug Webinar 2.0, and we've been on this course for over 3 days now. Though we had a glitch last night, and then this session for last night was rescheduled for tomorrow, Monday. We are sorry for the inconvenience, but now we have a lady in the house that all ladies and even men can connect properly and so easily because it is like-minded. Okay, she is really like-minded on this topic, and she's going to be expounding to us the effective use of contraceptives, right? So we've dealt with the overview, and yesterday, like I said, we were supposed to talk about the dangers of misuse and abuse of contraceptives, but couldn't hold. So tomorrow we will do that. Of contraceptives. Let's make welcome pharmacist Ceci Ogun, a clinical pharmacist currently working in Alpha Pharmacy Limited, one of the best in Nigeria. Okay, so she is blessed with a wealth of knowledge in this field, and she will be expounding to us how effectively we can put our failure with. So she is there to tell us how best we can use it so we can have the best therapeutic advantage of our contraceptives. Thank you so much. Famsese, the floor is yours. Welcome.
All right. Good day, everyone. Thank you so much for having me here from Penro. Kindly give me just like a second. Let me put something together. I'm coming, please. Thank you. Yeah. Oh, sorry about the breaking transmission. Can you hear me now? From Penro, can you hear me? Yes. From Penro, can you hear me now?
Oh, yes, yes.
Okay, all right. Okay, so I'll just start pending the time that my video would come on. Good evening, everybody, and thank you from Penwell for having me here. So, I'm going to be speaking on effective use of oral contraceptives for young professionals and for adults and everyone alike. So, we know that this topic that we are all discussing here is a very crucial aspect of health management, the effective use of oral contraceptives, and understanding how to use this medication properly is key to ensuring is very key to ensuring that they work as intended and also to maintain our overall health and well-being. Oral contraceptives, as we commonly known as birth-controlled pills, are medications taken to They are medications taken to prevent pregnancy. They contain mostly hormones, either a combination of estrogen and progestin, or sometimes just progestin, which works by either preventing ovulation, thickening cervical mucus, and thinning the uterine lining. When these drugs are used correctly, they are over 99% effective. I'm sure that some people
Yes.
definitely have their bias. Can you hear me? Some people have their biases about oral contraceptives and they're like, oh, maybe it really doesn't work, or is not as effective as it is supposed to be. But one thing I'll tell you that most times people wrongly use this. First of all, there is a misuse of contraceptives, and another one, there is also an abuse of contraceptives. And why does it matter to us in this age and time? Because it is a very significant aspect of our health, allowing us to focus more on what we have to do on our goals without the added worry of an unplanned pregnancy. So, what are the steps for effective use? Before you go on to use a contraceptive, it is advisable to consult a healthcare provider. They can help you determine the best type for your body and lifestyle. Then also you have to understand your prescription. If your doctor or your pharmacist tells you to, use it every day for a month, 27 days or 28 days, as the case may be, or for in the case of emergency contraceptives, because we have different types, and they tell, oh, use these two tablets at once in 72 hours, and you go ahead and use just one tablet. Well, it's not going to give you the required benefit, or it will not give you the result that you are hoping for. The another one is also follow the instruction. For people that are on a monthly regimen whereby they have to use it month after month, or the people that are on a particular course of treatment with oral contraceptives, you have to follow the instructions. You have to take the pill at the same time every day. This consistency helps to maintain steady hormone levels, ensuring maximum effectiveness. And sometimes you might be like, oh, I take this pill for consistently and I tend to forget because I have to use it for 27 days or 28 days. And you tend to forget whether you're supposed to use it maybe in the morning or in the evening at a particular time. And maybe due to your busy schedule, you can't use it, you tend to forget. You can set a reminder systems, set alarm on your phone. There are apps that can help you, remind, or you set your routine around this particular drug, because definitely you know the goal you are trying to achieve. So you can set a routine around it so that you can always remember. And for what happens to people that maybe, oh, they forgot to use today's dose and they are just remembering like tomorrow morning, what you have to do, you have to use the dose as soon as you can. As you remember, just take it as soon as that. Yes. So you have to follow the instruction on the pack, or as given to you by your health professional. And also you have to also understand the potential side effects that some of these drugs are given. So some common side effects mostly are nausea, headache, and mood swings. And for especially people that are on monthly regimen with oral contraceptives, this side effect definitely would reduce per time. Yeah, maybe the first few weeks you start might have like pronounced maybe headaches, nausea, and but as you continue using it, the symptoms do what they reduce it and you experience less side effect. But if the symptoms are severe, definitely you have to reach out to your healthcare provider to complain and say, oh, this is how this drug is reacting with my system. Then they will find a way out for you. Then if you are on oral contraceptive as prescribed to you by your healthcare, you know, provider, you have to schedule regular checkups with your healthcare provider to ensure that that particular contraceptive is still the best option for you, and to address any concern or side effect. So if you are supposed to use the drug for like 3 months or 6 months, don't just okay fine, yeah, every month I'm going to just refill my prescriptions. No, you have to always be in touch with your healthcare providers to, if you have any concern, you speak with your healthcare provider so that they can, allay those fears. Then also lifestyle consideration. You have to maintain a healthy lifestyle. So not that, oh yeah, I'm on contraceptives, so definitely I have to do what I have to do. So you have to also put your health in front too. So you have to check that, okay, fine, you're doing what you're supposed to do so that you don't get some other illnesses that would counteract the effects of the contraceptives that you are on. And also some of these medications might interact with some of your current medications that you are on currently. So these are the things you also have to discuss with your doctor. So, oh, I'm currently on this medication that I use either regularly or routinely. This particular brand of contraceptive that you are giving to me, I hope it would not interact with those medication, or the medication I'm using previously will not interact with those current ones so as to reduce the effectiveness. So these are the conversations you have to have with your healthcare practitioner so that the contraceptive would work effectively. Then also, like I said, we have emergency contraception. And also, if you're not on any, maybe you're not on a monthly regimen of contraceptives, you have to, and perchance maybe you had unprotected sex, right? And you have to prevent unplanned pregnancy. There are emergency contraception that you can use that would actually help prevent pregnancy. So oral contraceptive also give additional benefits apart from the whole unplanned pregnancy. For some people, they are placed on oral contraceptives so as to regulate their menstrual cycles. Some, it tells them to regulate menstrual cramps and also manage conditions such as acne and endometriosis. So you have to understand what your needs are. Actually, that's why I said before you start using any contraceptive pill, you have to first of all have a discussion with your health practitioner. It's not a drug. Yes, some of these drugs can be gotten over the counter, but you have to actually still speak with the pharmacist you're getting such drugs from, or even a doctor in the case might be, so that they can actually put all your needs together and say, okay, fine, which one is the best but best pill I can use, which regimen of contraceptive would actually address my own concern and also take care of some other health challenges that I might be having. I hope you can still hear me, and I hope you're getting one or two things. Yeah. So we have different types of contraceptives apart from the oral contraceptive. But the oral contraceptives are basically into, we have the combined pills and the progestin only pills. The combined pills contain both estrogen and progestin. So they work by, how they work is by preventing ovulation to happen. Then also we have progestin only pills, and they are suitable for those that cannot take estrogen. That I'm saying that you have to actually still speak with your health practitioner, because yeah, you can use some particular pills and you have lots of side effects, and the effects you are expecting and the results you are expecting, you really are not getting it. So you have to speak. So if the combined pills are not working well, there are other types that you can also use, to actually help prevent unplanned pregnancies. So other types of contraceptive, by the way, we have the barrier methods, which is the condoms, and also we have diaphragms and cervical caps. We also have the intrauterine devices, which is the IUDs. We have the hormonal IUD, which releases progestin to prevent pregnancy. And also we have the copper IUDs. We use copper to create an environment hostile to sperm. Then also we have the implants and injections. Then also we have the emergency contraceptive, which are pills that are taken after unprotected sex to prevent what? Pregnancy. So, how do you use it? First of all, consistency is key. Depending on the drug contraceptive drug regimen you're placed on, if you have to use 28 tablets, you have to use it the right way so as to get results. Then also you have to, like I said earlier, follow prescription, following instruction, and such. I don't know if there's any question for me before I continue.
Um, no, there's no question for now. Aside from the poll, which we will take almost at the
Okay,
end
so
of the lecture.
all right. Okay, thank you. So I'll be focusing the rest of of my talk on oral contraceptive because that is the one most people are used to. And like, oh yeah, I went to this hospital, or oh, somebody gave me this tablet so you follow the line. Yeah, oh, it comes in 28 tablets. I have to follow the line and use it every day. So this is how I use it and all of that stuff. So that's why I'll be focusing mainly on oral contraceptives. So like I said earlier, they're categorized into two. We have the combined oral contraceptives and the progestin only pills. Each type contains different hormonal composition and dosages tailored to specific needs and preferences. You can see me keep on mentioning specific needs and preferences. So you are not like, oh, my neighbor or my friend use this one, my colleague used this one, and it's working for her. So me too. I told her to tell me the name. So she told me the name. So I went to a pharmacy, I got it, and I've been using it, but still yet it didn't work for me. Oh, I use it, and all of a sudden I'm having several side effects that I don't like. Is that how contraceptive work? If contraceptive works that way, please, I don't think I want to continue. So that's what I'm saying. You have to speak with a health practitioner so that they can put your needs and give you a personalized healthcare plan as regards this very topic. So, combined oral contraceptives contain both estrogen and progestin. We have the monophasic pills, and each for the monophasic pills, each active pill contains the same dose of estrogen and progestin throughout the cycle. An example is the common one we all know that we call it a P2 or post pill. So that's like a monophasic pill. This other one we also have biphasic pills, which one the hormone dosage is changes once during the cycle, and it contains ethylene estradiol and disoegestrel 50 milligram for the first 10 days, followed by ethylene estradiol and the esogestral for the next 11 days. So we have triphasic pills. The hormone dosage changes 3 times during the cycle. So we can see that we have the monophasic, the biphasic, and the triphasic pills. For the monophasic pills, it helps to maintain same level of hormonal levels throughout the cycle. For biphasic, at a point it is higher and at a point it is low, so as to just give the required results that is intended for. We also have the extended cycle pills, this is designed to reduce the frequency of periods to once every 3 months. So we have ethylene estradiol 30 microgram plus levonorgestrel 150 microgram taken continuously for 84 days, followed by 7 days of placebo or low dose estrogen pills. So also we have the continuous cycle pills, which is taken continuously without a break, eliminating periods altogether. Example is the ethylene estradiol 20 microgram plus levonorgestrel 90 microgram taken every day without placebo pills. So we can see that we have different types. So
Okay, so
you
sorry, ma'am. So when you
all
say
right.
placebo, what do you mean? Yeah.
All right. Okay. So, like I said, we have the monophasic, we have the biphasic, and we have extended cycle pills. So the placebo pills, they do not contain the active ingredient that is supposed to stop ovulation. So for some people that are on that type of regimen, when you are taking your placebo pills, most time that is when your period comes.
Yeah.
And I
That's
also
true.
spoke about extended cycle, that you only see it reduce the frequency of periods to once every 3 months. So at that point, you keep taking the pills that have the active ingredients of this contraceptive. So immediately you take it for 84 days, then followed by 7 days of placebo or low dose estrogen. So it gives that allowance for for your period cycle to just begin in that point in time. So placebo pill doesn't contain the active ingredients contained in the other pills and other days. So
That's true.
I've spoken about, combined oral contraceptive. So moving on to progestin only pills, we have the typical progestin only pills and the SNID one. For the typical pill, we have each pill contains the same dose of progestin. And for the Drosperi non-only pill, it contains drospirenone 4 mg and is taken daily without a hormone-free interval, similar to the combined oral pills. So, what are the dosage regimen for combined oral contraceptive? So we have the 21/7 regimen, we have the 24/4 regimen, and we have the extended and continuous regimen. For the 21/7 regimen, it has 21 days of active pills, followed by 7 days of placebo or no pills. Like I mentioned earlier, the placebo and the active ingredients contain. So for the 21/7 days, so you take the pill 21 days, it has the active ingredients in it. Then for the 7 days of placebo, nothing there. Then we have the 24/4 regimen, which is 24 days of active pills, followed by 4 days of placebo. Then also we have the extended and continuous regimen, which you have to take the pills continuously for 84 days or longer, with or without a short placebo interval. And this, you cannot just place yourself on this regimen. You have to actually speak with your doctor most times, or a pharmacist, and they consider your health, your needs, and even some symptoms that you currently have as a female, and then look at the one that would actually address those needs and take care of them. So for progestin only pills, you take them every day at the same time without a break. There is no placebo pills in the pack, and there is no break period. So compared to the 21/7 or 24/4 for progestin only pills, you just keep you taking them at a particular time of the day of your own choosing. So you decide, oh, it is I prefer using my drugs in the morning, maybe after breakfast or something. You continue using it at that time, or in the evening, so you just continue taking it every day without a break. So is there still any question for me, or I should just continue? So oral contraceptive can significantly alter menstrual flow with
Okay,
some
sorry.
regimens designed. Okay.
Okay, sorry, ma. Sorry, I was muted. So this person is asking this question. Which contraceptive method do you think is the best, that works effectively, like the best contraceptive method you think is the best? Well, that question is for you. So, what do you think is the right answer for this person?
Okay, like I said, it is not a one size fits all. So I can't just tell you, oh, this particular one is the best. No, it is always a personalized treatment for everyone. So I have to maybe have a sit down with you. We discuss your health plan. We discuss your likes basically on how compliant you will be with these particular pills. Then before I can then tell you, oh, you can use this particular one. It fits right in into your lifestyle or even your health regimen currently. So it is not a one size fits all. It is a personalized, individualized plan for contraceptives.
Oh wow. Well, that's apt. Thank you. Go ahead, man.
All right. So, oral contraceptives can significantly alter menstrual flow with some regimen designed to reduce the frequency of periods or even stop them altogether. The specific effect depends on the type of contraceptive and the individual's response. And it still boils down, you have to actually speak with your health provider so that they can help tailor the contraceptive use to your preference and health needs, ensuring both effectiveness and comfort. Yeah, so then made most question like, oh, I'm not on oral contraceptive. I don't think I can, continue and use lots of pills every day for a long period of time and all of that stuff. On what happens, when unprotected sex happens and you have to quickly use a pill because you don't want to get pregnant. That is where emergency contraceptives come in. So emergency oral contraceptives, commonly known as the morning after pills, are medications taken to prevent pregnancy after unprotected sex or contraceptive failure. So we have the levonorgestrel based pills and the upistry acetate. So how does this pill work? For levonorgestrel pills, they prevent ovulation and they may prevent fertilization. Why the upistry acetate pills delays or inhibit ovulation as a whole. So what is the timing that for this? For the levonorgestrel, that which is the most commonly used one in our country, Nigeria, it is most effective within 72 hours and can be taken up to 3 to 4 days after. So within 72 hours you can take the pill, and that particular pill is still effective for up to 72 hours. So you can't say, okay, fine, I had unprotected sex today, I'm using emergency contraceptive. Tomorrow you still go ahead and do the same and you have to take another pill. No, it shouldn't be so. So that particular dosage for that emergency contraceptive pill can cover you up to 72 hours. And also the uliftal acetate pill is effective up to 120 hours, which is 5 days after unprotected sex. So you can see that we have pills that can be used for emergency use also. And these pills have success rates. You can from research has shown that when you use the levonorgestrel pills, it is approximately 87% effective if taken within 72 hours. So 87%, it still covers you if you use it within the time frame. If it is after 72 hours and you go ahead and use it, definitely you should know that the effectiveness of that particular pill is going to reduce drastically and it can lead to unwanted pregnancy. Then for lifestyle acetate pills, it covers up to 120 hours and they are very, very effective. So what are the factors affecting effectiveness of these pills? First of all, is timing of administration. Like I said, the one that is for 72 hours. and the one that is for 120 hours. Then also body weight and individual metabolism. That's why you don't just go in and just get this pill. First of all, have a talk with your health provider so that they can advise you accordingly. Then, of course, some of these pills might have side effects. So, what are the common side effects? One could be nausea, it could be fatigue, it could be headaches, it could be dizziness, it could be breast tenderness, and even changes in your menstrual cycle. Because changes in your menstrual cycle, because these pills that you're using, they are hormones, and they have gone to either inhibit ovulation, inhibit fertilization. So definitely there will be a change in your menstrual cycle. And if perchance, you have serious side effects that are different from the ones I've mentioned earlier, what you can do is quickly get in touch with your health provider, and there would always be a solution to that side effect. So do not suffer in silence. Don't say, oh, I will just keep quiet and let me just write it out. If after 1 to 2 days you are still feeling some of these effects, quickly put a call through or go see a doctor, and they would find a way to address the issues that you are having. So there are several myths surrounding emergency oral contraceptives. Some might say, oh, it can affect future fertility. Oh, it is not safe for most women. No, I wouldn't say that. Emergency contraceptive does not affect future fertility at all. As long as you use it within the right dosage, the right timing, it would work the way it is supposed to work. And like the name connotes, emergency oral contraceptives. It's not every month that there should be emergency. It is not every week that there should be emergency.
Mhm. Okay, we're sorry about that glitch. I believe our speaker will be right back here. Just a moment, please.
Hello, can you hear me?
Okay,
Can you hear
just a
me now?
moment. Yeah, welcome back, ma'am. All right, so we are good to go.
me? Okay, all right. So the common question now is, oh, I don't want to be placed on a regimen because I don't think I'll be consistent. Can can you hear me?
Yeah, I can hear you.
Can you hear me?
I can hear you. I can hear you.
Campeno, can you hear me?
Yeah, yes, I can hear you. Can you hear me? Oh,
Can you
this
hear
is.
me?
Yeah, I can hear you now. The network is bad. Really sorry for
Okay.
that. Okay.
Yeah. All right. So, how often should I use emergency oral contraceptives?
Very
So,
well. I was waiting for that
emergency oral
question.
emergency oral contraceptives are intended for occasional use and not as a regular method of contraception. Here are some
Okay.
areas where you can consider using emergency oral contraceptives. One is occasional use. It should be used only in emergency. Like I said, it is not every month that there should be an emergency. It is not every week that there should be an emergency. It should be only used in emergency, such as after unprotected sex or contraceptive failure. Either maybe the condom that was used broke or missed birth control pills. They are not meant for regular or frequent use. Or emergency oral contraceptives are effective at preventing pregnancy after unprotected sex. They are less effective than regular ongoing contraceptive methods. So if you keep using it week in, month out, definitely the effect is going to be reduced in your particular case. So there should be regular use of reliable contraceptive method by using birth control pills. Like I mentioned, we have the combined oral contraceptives and we also have the progestin only pills. Then we also have other types like either using the implants, IUDs or condom. So those ones are recommended for better pregnancy prevention. Well, when it comes to say strict limit to the number of times you can use emergency oral contraceptives in a year, but frequent use may lead to more side effects, such as menstrual irregularities. And also, if you keep on relying on emergency oral contraceptives, that means that you need to go see a healthcare provider to place you on a proper birth control pill. It should not be your primary method of contraception. So if you notice that, oh, every month I have to buy a pill, every week I have to buy emergency oral contraceptive, then you should tell yourself, you have to be, true to yourself and tell yourself that, oh, I can't not continue this way. Why about I just go and just use either the monthly dose or the 3 monthly dose and it covers your health plan concerning that particular need. Then also, if you find yourself needing emergency oral contraceptive frequently, it is important to consult with a healthcare provider. They can help you explore and choose a more effective long-term contraceptive method that suits your lifestyle and needs. It is not a time that you should be like, oh, I don't want to talk to anybody so that they don't look at me a certain kind of way. Please, I think we are in a age and time whereby we can be free with our healthcare provider as to our healthcare needs. So don't shy away from discussing this with your healthcare practitioner or your pharmacist, as the case may be. Go in and just sit with them and tell them, oh, this. I need to be placed on the birth control pill. No one is going to castigate you. No one is going to look down on you. So just go and have a talk and they would advise you accordingly. So, in summary, emergency oral contraceptives are safe for occasional use. They should not be used as a regular form of contraception. For ongoing contraceptive needs, you have to discuss more reliable options with a healthcare provider. So, I think that will be all from my end. If there's any question, then I'll take them. Thank you.
Wow, wow. I'm so saying, can I clap for you? Thank you so much. That was apt. That was apt. Kept simple, kept short. Please, if you have any question, this is the right time to drop the question. Thank you so much, Famsesi. Uh, we are so blessed to have you this night. All right. So before we go to our pool of questions, I want the live viewers, please, if you have any question, drop it and we'll project it so that our guest speaker can do justice to that already. All right. So I'll give just 1 minute for those that have questions here. We'll attend to your question first before we go to the pool. Let's give you that respect for being here. Okay. Um from Ceci. Hello from Ceci. Okay, so we are still waiting for your question. Okay, Famsese is here now. So Famsese, can you hear me?
Yes, I can hear you.
All right. Okay, so this then I have gained a lot, and we believe that our audience have gained a lot. But in this case, do you think that the barrier method is very is an effective method of contraception? I will add these two questions. I'll put the two together. Is the barrier method? This person is putting up some concern that she has been hearing about barrier method, not 100%, but she had never seen anybody who used the barrier method and was very careful that had a failure with it. Okay. So how true is that statement that the when I mean the barrier method, we're talking about condoms now, please. Just condoms only. There are other barrier methods like the caps and the other things, yeah.
Um,
That yeah. So let me just put the two together now. How effective is the barrier method? Has it recorded any failure rate before? I mean any failure before? Then the second question. Okay, the second question is, all right, how many times is best to take an emergency contraceptive within a month? How many times is best to take an emergency contraceptive in a month? Thank you very much.
within a month. Okay. Can you hear me?
Yes, yes, yes.
Okay. So I'll start from the last question, which is how many times can oral contraceptive be used within a month?
Like the
First of all, are
emergency,
you
like
using
the
the
emergency.
emergency oral contraceptive? Yes.
Yes, yes.
Okay. Are you using the emergency oral contraceptive the way it should be used? So, keeping in mind that a particular emergency, depending on the one you're going to be used, if it's the levonorgestrel pill or the upistry acetate pill, it covers up to for levonorgestrel, it covers up to 72 hours. So first of all, I using it the right way. Then also for the upistry acetate, it covers up to 120 hours. So if after putting in consideration that particular timing, within 120 hours after using an initial pill, depending on whether it is levonorgestrel and upistry acetate, which is 72 hours and 120 hours respectively, you know that if you use those pill, you cannot use another one. So that should do what should cover for that. Then maybe after the 72 hours, something else happened that is either unprotected sex or barrier failure. Then I think at most two dosages of emergency oral contraceptives should be used at most in a month. If it is getting to more than two particular dosages in a month, you should know that you need to speak with a doctor that emergency oral contraceptive would no longer be a primary contraceptive regimen for you. Then you have to speak with a health practitioner so that they can place you on a proper. I don't know if you got that.
Yeah, very well. Yeah, very well. So in what you said
Then
is, if someone is going more than two contracept or I mean emergency contraceptive pills a month, we need to discuss with the healthcare health giver for another suitable method, right?
yeah, yes,
Okay,
yes.
okay, good, good. So I believe that person has taken note of that. Okay, so the other question.
Okay, so how effective is the barrier method, and what are the barrier methods available to us in the market today? We have the condoms, and we have the diaphragms and cervical caps. So for the condom, it depends on usage. If you notice that, oh, most times either the condom breaks or there is a leakage somewhere, then you know that you have to be true to yourself and tell yourself, okay, fine, this is not an appropriate contraceptive method for me. Then we have diaphragm and xiphical cups. So if those ones are used properly without any discomfort whatsoever, of course it should be effective.
Oh, that's perfect then. That's perfect. So we could see from what you said that if the barrier contraceptive methods are used properly, there won't be so much failure rate with them, right? So
Yeah.
the
Yes.
problem comes now with the proper usage. Do I get that right?
Yes. Yes.
Oh, okay. That's
Yes. Yes.
fantastic. That's fantastic. All right. So people, fix your condoms very well, fix your cervical caps and your
Avio.
diaphragms very well, right? And the what?
Yes. Yes.
Mm-hmm.
And be rest
Okay.
assured that it's going to help prevent unplanned pregnancy.
Okay. Okay. That's fine. That's fine. So there is something else I got. This is not a question. I from what you have discussed this night, I got that there is no best contraception method that exists, right? So the one that is best for you is the one that you've sat
Yes.
down with your healthcare giver and discuss. And there's something I like very well you said in relation to your career. You discuss it in relation to the work you do, the one that is suitable, the one that some people just get along with. Okay, I want to be safe, and they just dash into anyone without advice, without counseling. So my take home here for me is that I'm not a lady, but if, if I'm to advise anyone, I would say sit down with your pharmacist, sit down with your doctor and discuss things out, and he or she will find a suitable method
Yeah.
for you. All right. So the first day we talked about the sensitivity to this subject, contraceptives, and we talked about a lady who refused to take her contraceptive pills because the husband is not taking. Uh, okay, so it's more like the ladies are bearing the blunt of this whole thing. So Famsesi, what form of contraceptives or contraception methods are available for men? Like what forms? What should the men just be there and sorry to say I'm very raw right now. I'm not Pastor Penwell now. I'm your pharmacist. I'm a pharmacist rather. So should the men just be there and be releasing sperms, or do they have any part to play? Famsese, that question, can you do something to it? Do the men have any role to play, or they should just be there and be ejaculating? So what are the roles of men? Is there any form of contraceptives for men? Our network is not doing us good today. This is Nigeria. I mean, it will be greatly helped. Sorry, we lost our guest speaker. I believe she comes up very soon. Mm. All right, great people. We wouldn't take your time any longer. We intended that this should be less than 1 hour, and it's almost 1 hour. So I asked that question. Let me quickly answer it. Okay, for the men, we have the barrier methods, right? The external condom, right, for the men, right? And then we also have a very extreme method, which is invasive, like needs operation and that is the vasectomy, where the vas deferens is being tied, or um sorry, our guest speaker is here once again. Okay, so Famsesi, can you hear us now? Are you with us now?
Did you
I
ask me
think
any
the,
question?
okay, yes, yes. So I asked, I was about answering it because of the network, but you are our guest
Yes.
tonight. So I asked if the men
Yes, I
should
can
just
hear
be
you.
there,
Yes, I am.
the men should just be there ejaculating.
Yes, I can
So
hear you.
yeah, which form of contraception, which method of contraception is available for men?
Okay, if there's any contraception available for men, okay. So, like we said, the barrier method mostly for men, and also we have the sterilization method for men also. Did you get that?
Yeah. That was asked. The sterilization. Okay. Yeah.
Yeah.
So that is it, people. So men should not just be there ejaculating. Please take
Yes, so
yeah, of course. Yeah, so
especially for the married ones in the house, and if you know that okay, fine, you're done giving birth to the number of children, you can go in for the sterilization method and it will take care of that. And in case that oh you're still single, at least make proper use of the barrier method. It helps.
oh that is very sensitive, I'm saying,
How
So
what do you mean by sensitive?
okay, will every man, how many men do you think will willingly go for sterilization?
Like I said, it
Mm,
mostly sterilization method is advised to men that has at least given birth to the number of kids they have in the plan. And there are different type of sterilization methods. Sometimes
okay.
there are types that are reversible,
Oh,
so you can go in for the reversible type if you know that oh you don't want to just be giving birth to children like that. So you can go in for the reversible one, knowing that yes, it can always be reversible and everything will be back in place.
we'll be
So I
back
think
again.
that's a conversation that we should actually start talking about the sterilization method for men also. So men too can be in control
Okay.
of the whole pregnancy narrative.
Wow. That's awesome. That's awesome. Good to know. What a wonderful knowledge to know. Wow. Okay. Um Once again, Famsesi, thank you for sharing your wealth of knowledge with us on this subject. We are blessed to have you. Thank you so much, and I believe that anyone that comes across this will find it valuable. Thank you. Have a lovely time. To our audience that have been with us till now, I believe you have gotten some value, and your knowledge has been enhanced in this wise. Uh, have a nice night, and you can always come back to the video on this platform. You can share. I will share the link in the box, or you can copy the link, share with your friends, your colleagues, so that nobody is left behind on this important subject. Thank you very much, everyone. Have a lovely night.